Happy New Year and welcome to the January 2017 issue of our monthly Mayo Clinic Proceedings Multimedia Summary. I'm Dr. Thomas Beckman, an Associate Editor at Mayo Clinic Proceedings. I'm also a Professor of Medical Education and Medicine at the Mayo Clinic College of Medicine and Science. This month there are 4 articles making up the Editor's Choice and Highlight selections featured in the Mayo Clinic Proceedings. Our Editor's Choice article is a meta-analysis of omega-3 fatty acids and coronary heart disease risk by Dr. Dominic Alexander and colleagues from the Department of Epidemiology at Epidstad Institute in Ann Arbor, Michigan, and other institutions. They noted that EPA and DHA may be associated with reducing coronary heart disease risk, with a greater benefit observed among higher risk populations with elevated triglyceride or LDL cholesterol levels. This article also has an accompanying editorial by Dr. James O'Keefe from St. Luke's Mid-America Heart Institute and colleagues from several national healthcare institutions. They comment that several large randomized clinical trials are underway which should help to clarify the issues surrounding the dosing and indications for omega-3 fatty acids. In the meantime, omega-3 fatty acid intake of at least 1 gram of EPA-DHA daily, either from seafood or supplementation, as recommended by the AHA, continues to be a reasonable strategy. Our first highlight in the January 2017 issue of Mayo Clinic Proceedings is an original article authored by Dr. Ruk Sen Chung and colleagues from the Mayo Clinic in Rochester, Minnesota. It addresses the rates of celiac disease diagnosed from 2009 through 2014. They found that the prevalence of undiagnosed celiac disease decreased over that time period. This suggests a success in detection, an increased awareness of celiac disease, or maybe an increasing preference for a gluten-free diet. The second highlight in this month's issue is a consensus recommendation authored by Dr. Irwin Goldstein from Alvarado Hospital in San Diego, California, and colleagues from several other institutions. They found hypoactive sexual desire disorder, HSDD, affects 6 to 19% of adult women and is associated with lower health-related quality of life, lower happiness and satisfaction with partners, self-assessed poor health, and several medical and psychiatric conditions, including urinary incontinence, thyroid disease, anxiety, and depression. It is hypothesized that the pathogenesis of HSDD is attributed to an imbalance in central sexual excitatory and inhibitory pathways. The treatment of HSDD should focus on the factors that are most distressing to the individual and should engage both psychosocial and biological strategies. Because distressing low desire significantly affects a woman's quality of life and relationships, clinicians should assess women for HSDD. The third highlight in this month's issue is a special article authored by Dr. Tate Shanafelt and Dr. John Noseworthy from the Mayo Clinic in Rochester, Minnesota. They outline 9 organizational strategies that institutions can use to address the high rate of physician burnout being experienced in the current healthcare environment that threaten the survival of many healthcare organizations. National studies suggest that at least 50% of U.S. physicians are experiencing professional burnout, indicating that most executives face this challenge with a disillusioned physician workforce. Physician burnout has been shown to influence quality of care, patient safety, physician turnover, and patient satisfaction. Although burnout is a systems issue, most institutions operate under the erroneous framework that burnout and professional satisfaction are solely the responsibility of the individual physician. The authors describe how implementation of these strategies at Mayo Clinic are working and note this demonstrates that deliberate, sustained, and comprehensive efforts by the organization to reduce burnout and promote engagement can make a difference. And as always, you can access these highlights and Editor's Choice articles free of charge during the entire month of January. Please check out our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org and review some of the other free content there. You can use the social media buttons near the top of our homepage to stay in touch with us on Facebook, Twitter, and YouTube. On Facebook and Twitter, we keep you up to date on online first publications that come out on our website between the monthly issue updates, and on news stories that are based on articles published in Mayo Clinic Proceedings. On YouTube, you can find a lot of interesting video content such as full author interviews or also our 60-second video article summaries. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.